Good morning, everyone. Welcome to the November 18th Public Health Media Briefing. You'll hear from the Public Health Officer, Dr. Kassirier. She'll give you a brief update on our case counts, and then Rachel Allen will give you an update on vaccinations, and we'll open it up to the media for questions. As always, please raise your hand. I will call on you. And with that, I'll hand it over to Dr. Kassirier.
Good morning, everyone, and thank you for joining us. So with the numbers, we are at 161,341 cases of COVID-19 reported to Sacramento County. We are averaging about 170 cases per day, and the case rate as of this morning is at 10.9 per 100,000. So over the past week, we did see a decline in the case rate, and so we are continuing to monitor that. The deaths are 2,405, and we're averaging about 2 deaths being reported per day. One major update from last week is that the state health officer issued a letter, a message to healthcare providers in the state of California to remind them about the importance of booster doses. We do understand that some people in the public and some of the providers have also had not been very clear on the criteria for who can get a booster shot. So this letter was to try and clarify that. And the 3 major points are: one, that healthcare providers should proactively vaccinate and provide boosters to those that are at highest risk, those over the age of 65, those with underlying medical conditions, and also those that had received the Johnson & Johnson vaccine. The second point was that they should allow patients to self-determine their risk of exposure and not turn people away. So anybody over the age of 18, if they showed up and requested a booster dose, they should be able to get it. And for those that received the Moderna or Pfizer, it's after a 6-month period. And for the Johnson & Johnson, it's after the 2-month period from their first series. And thirdly, for pharmacies to prioritize long-term care facilities. We know that the vaccine has been very effective in preventing outbreaks in long-term care facilities, so we want to be able to maintain the protection for those vulnerable populations. So we would like to make sure that they get the opportunity for booster shots. And with that, I will turn it over to Rachel to talk more about vaccinations in Sacramento County.
Hey, good morning. Just wanted to give an update on our pediatric rollout. Of course, we're continuing all vaccinations, but last week we did add the pediatric Pfizer. Most clinics got that up and running, and we're really encouraged by the number of families that we see coming to our clinics, as well as reports from our partners that their clinics have been very well attended. I'm happy to see families and children coming out. It's very encouraging. And just a reminder that COVID-19 is a vaccine preventable disease. We do protect our children with other vaccinations, for other deadly diseases. And so this is just another important step to keep them safe and also to help us reach herd immunity. So pediatric Pfizer is at clinics all throughout the county. There are some clinics beginning in schools that are in the quartile 1 of the Healthy Places Index, and those are being coordinated by the state. We are supporting those efforts with vaccine and ancillary supplies. We have a number of established COVID-19 providers who are also offering pediatric Pfizer, both working in schools as well as some community clinics. And then our county pop-ups also have pediatric Pfizer available. We're also continuing our efforts to redistribute pediatric Pfizer vaccine to as many practices as we can. We go out almost daily with deliveries to make sure that this vaccine is available in any practice that is ready and able to vaccinate children. And then just to add an additional comment to what Dr. Kassirier said about the booster policy, we just want to remind folks, again, the state did allow patients to kind of self-determine that risk of exposure, but you do need to make sure that if you had an mRNA vaccine, so either Pfizer or Moderna, that it's been 6 months since your last dose. or if you had Johnson & Johnson, that it's been 2 months since your last dose. And don't forget to bring out your vaccination card so that we can update it and update your record. Thank you.
We will now open it up to questions from the media. Please raise your hand if you have a question for any of our public health staff. Mike, go ahead.
Hi, this is Mike Sackby. Do we have any sense of where hospitalizations stand in terms of both COVID and other influenza, or I know RSV is going around statewide kind of?
Yes, we know that the hospitals are still very busy, but it's not just due to COVID. Our COVID numbers have reduced and they've bounced around between 150 and 160 total hospitalizations. Some of the major hospitals especially are still seeing quite a number of COVID cases, but they are also seeing other conditions as well, and that's keeping them pretty busy.
Any other questions from the media? Just a reminder, this is the only media availability for public health staff today. Go ahead again, Mike.
Yeah, do we have any sense on the numbers of where we are for boosters, about how many eligible, how many who are 6 months past their second dose or 2 months past J&J have actually gotten a booster dose?
I can get that number for you, and we'll get back to you.
Thanks.
Okay, questions for the media, going once, going twice. That concludes our public health media briefing for November 18th.